Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Ma'am, at this point of time, all I can say, like epilepsy is a very widely known phenomena, and it was known, the epilepsy was known by other names in ancient times as well. And it is quite imperative that we, in this area of modern medicine, we are well aware of this disease, which is usually easily treatable with medications and or surgery where indicated. So I believe that all of us should have some basic idea, as we might have come across a person or a family member who may have been suffering from this illness. I guess with this podcast here, we will be able to gain some insight regarding this problem.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, ma'am. Usually, what happens is that our brain is something like a powerhouse. It's a machine, and it uses tiny signals. There are electrical signals which control things like how we think, feel, and act or behave. Now, whenever this machine, the signals, when they become overloaded, so that is when the brain gets overloaded by the abnormal amount of activity, and this results in a seizure. Now, what we see is a seizure. Very often, it is described as a storm in the brain, and during this, the patient may the patient may become unconscious. The patient may have convulsions. He might be shaking. He may be confused. He may even have, sudden onset panic or fear. Patient may have a staring look. So usually this is how we identify these patients.
What is epilepsy?
Okay, ma'am. See, like a seizure is a single episode, whereas epilepsy, it is a medical condition where, patient has repeated seizure episodes. So usually a doctor will be diagnosing epilepsy if someone has at least two unprovoked seizures. That is, the seizures were not precipitated by something such as high grade fever, some kind of a brain infection, or trauma, etc. Now, epilepsy can be, of various kinds, various seizure types. The most commonly types were, the generalized, and the other common type was the focal type. So patients usually they tend to have, any one type, or it can have like a mix and match of all the seizure types.
What are the different types of seizures and do they affect people differently?
Yes, ma'am. There are different kind of seizures, and the type of seizure usually depends on what part of the brain the seizure is starting from, the activity is starting from, and how much of the brain it is involving. So the seizure is usually either it can be a generalized seizure, that is, involving a large part of the brain, where the patient presents with like a convulsion, or it can be a focal seizure, which is involving a small part of the brain, and it will start specific to that area, and the patient may, just have movement in a generalized localized limb, either the hand or the face. So it will not be involving the whole body. It will just be one affected part in the focal seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Okay, ma'am, like usually in 50% people who are suffering from epilepsy, there may be no specific cause that can be found. Whereas for the other 50%, the commonest causes in our line of work, we come across a lot of people with head injuries or, brain infections, CNS infections like meningitis. Uh, in a few people, things like brain tumors, they can also result in epilepsy. In the elderly population, that is people more than 65, there are diseases such as Alzheimer's, things like a stroke may also lead to epilepsy. And rarely it has been seen that genetics also play a role, especially if there is no other identifiable cause. So, researchers often say that certain genetic factors may predispose a person to develop epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Right, ma'am. Like the symptoms can vary a lot, but the most common signs of a seizure is the sudden convulsion or the jerking movement of the body, as we see. There might be loss of consciousness. Patient may very often appear confused, or he may appear, staring into space. And very often, people say they feel very strange or they feel very scared during this episode. And the people may shake, just one part of the body, or an arm or a leg.
Yeah.
And some of them may even, have falls. They can have this fall where they are falling down while having convulsions. So if we know somebody who has these symptoms, especially if recurrent symptoms, it is a very good idea that they consult a nearby a neurophysician or a neurosurgeon to know more about it.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Obviously, thing is, people are scared of things they don't understand, and historically, people did not really realize that epilepsy is a neurological condition, because obviously the person, he loses consciousness. There might be a change in his
Yeah.
voice. He might not recognize people that he lives around with. So very often, people feel it is something, magical, or it has something to do with magic. So a lot of myths are around it, and it does look frightening. So people do react to these episodes with fear, or they often avoid these patients. It kind of leads to a social stigma.
How does this stigma affect people with epilepsy?
Usually, it has been very commonly seen that people with this epilepsy, they are often faced with this negative attitude and discrimination, at their workplace, amongst their family and friends. And very
Yeah.
often we see young ladies with epilepsy where people are reluctant to marry them. They feel that this might be transmitted to the offspring. People are unwilling to employ these people, and usually, at times, people are even scared of being in the same room. They feel it may be something contagious. And, by being in the same room, you may catch it. So, however, you very well understand that this is not the case. And what we should do is that it has often been seen that this stigma or being a social outcast, this may often lead to worsening in the patient's condition, as research has seen that very often stress due to this stigma may increase the frequency of seizures, as stress is a common trigger. So at this point of
Yeah.
time, I feel the community needs to be supportive.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Right, ma'am. Usually the triggers may vary, from people to people, but yes, uh, the commonest are if you miss your medications, if you're on regular medications, anti-epileptic, if you miss a dose, you will end up getting a seizure. People who end up missing sleep, people who are in a high
Yeah.
stress, job, the stress can often do it. We should
Yeah.
make sure not to skip meals. That has a very important role. And things like flashing lights, like as commonly seen in discotheques or in video games, very commonly tend to precipitate seizures. Things like fever, things like illness, very often they can also lead to seizures. And in women, very often during hormonal changes seen during the menstrual cycles, this can happen. So what we ask is that patients should try and maintain a seizure diary, where they can kind of document the dates and the possible triggers, so that when they go to the doctor, they can kind of discuss it out, and we can decipher if there's any pattern to the seizure.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Okay, ma'am. Usually, like, we should try and inculcate healthy habits, as they in turn will reduce the risk of seizures. So things like getting a good night's sleep, avoiding like very stressful work environment, and we should try and manage our physical activity as well. Try not to be very fatigued at the end of a day. So eating regular balanced meals, staying active, doing yoga, usually it helps. And unlike what we commonly think, physical activity is generally safe for people with epilepsy. Yes, although we do advise that people who are into high risk export sports like skydiving and bungee jumping and so on and so forth, they should be extremely careful, and they should have like a prior medical examination before such an activity, so that the doctor can give them correct advice. And
Yeah.
usually, like I already said, stress management is very important, especially in today's world where everybody is stressed. So I believe that relaxation techniques, yoga, etc., counseling groups, support groups, they also play a very important role.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, definitely, ma'am. Like very often people tend to fall down suddenly when they are, having this convulsion. So we should try and remove all the dangerous things that may be around them. If they're in the kitchen, make sure that, they're not allowing any sharp objects. So any things like cord, clutter, the sharp corners in the furniture nearby, we should try and remove those things. And we should try if we are, we have history of seizure episodes and we are on medication when we are alone at home, all the dangerous activities like cooking over an open flame and all, we should kind of avoid. Rather use a microwave for doing the same amount of cooking. That is much safer. And yes, we feel that soft carpeting at home can also help reduce the risk of injury if you do tend to fall during a seizure. So these are small things which we can do.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Uh, Ma'am, at this point of time, just to summarize, with the right treatment, I feel that people with epilepsy can manage their condition very well, and they can have very. I also feel, yeah,
Yes, doctor.
and I also feel, yeah, by having medications on time, having the
Yeah.
right treatment, it can help them a lot. And we should be gradually, we should become aware of our trigger factors. We should practice healthy habits, healthy eating, and always having a support group or family members who are well attuned to your needs. It always helps in the long run. So we should always keep in mind this is a very much treatable and curable disease, and there's always a community support which is there to help us out.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.